Closing the door, closing the curtain for patient privacy, hand hygiene, 20 seconds. Hello, my name is Susan and I'm going to be your nurse for today. So today I'm going to be inserting a urinary Foley catheter for you, which has been ordered by your provider to help with your urinary retention. Before we get started, can you please state your name and date of birth? Okay, Jane Jones, date of birth, January 12, 1960. Okay, and that matches with your patient ID wristband. Miss Jones, do you have any allergies? No allergies? Great. And do you have any pain right now? No pain? Wonderful. And I do see that you are alert, responsive, and not in any distress. Okay, so Miss Jones, as I was saying, today I'm going to be inserting a urinary Foley catheter for you. So first off, I'm going to be cleaning your genitals twice, and then I'm just going to be simply inserting the catheter. Next, I'm going to take a 10 milliliter urine sample from you to send to the lab. And lastly, I'm going to be attaching the catheter tube to your thigh with a stabilizer. Does that sound good? Yes? Okay. And have you had this procedure done before? Yes? And do you have any questions or concerns for me before we get started? No? Okay. And so for my supplies that I'm bringing in, I have a Foley catheter kit, a 10 milliliter syringe, a box of clean gloves, an extra pair of sterile gloves, CHG wipe, a stabilization stat lock. I also have some extra towels and extra chucks, and the patient already has a chucks placed underneath them. And lastly, I have a basin with some warm water and soap. Okay, so now I'm going to go ahead and do hand hygiene, don some new gloves, and prepare my workspace. Okay, I'm going to go ahead and take a disinfectant wipe and disinfect my surface for 30 seconds. And I'm going to make sure to get every inch of it as well as the edges. Okay, so now that it's been 30 seconds, I'm going to go ahead and let my surface dry for 2 minutes and let all the bacteria, let it kill all the bacteria. I'm going to do hand hygiene. Okay, so now that it's been 2 minutes, I'm going to go ahead and place all my supplies onto my surface. Okay, now I'm going to go ahead and do hand hygiene, and I'm going to don some clean gloves. All right, Miss Jones, I see that you are already in a supine position, which is great. Now I'm going to go ahead and move your blanket down. I'm also going to lift up your gown and expose you just a bit. Okay, and I'm also going to open up your legs and assist you into your froggy position. All right, Miss Jones, so now I'm going to go ahead and clean your genitals with some warm water and soap. So I have my basin here. I also have a towel to dry off the area. Okay, so now I'm going to go ahead and clean your genitals. Middle, outer right, outer left, and one last general swipe. Okay, so now I'm going to go ahead and pat the area dry, like so. Okay. So now I'm going to go ahead and do some hand hygiene, and I'm going to open up my supplies. Making sure I'm only touching the outer 1-inch border. Okay. And since I've already done hand hygiene, I'm going to go ahead and take out the pair of sterile gloves. And I'm also going to take out the drape. Make sure I'm only touching within the outer 1-inch border. Shiny side down, matte side up, and I'm placing it in between the patient's legs. Okay, and lastly, I'm going to take out the second drape that we're not going to use. All right, so now I'm gonna go ahead and drop in my syringe and my CHG wipe. Okay. All right, so now I'm gonna go ahead and do hand hygiene and don sterile gloves. Okay, since this glove is on, I'm going to go ahead and fix this hand, making sure I'm only touching the outside. Okay, and I'm gonna go back here and fix it. Okay, I'm gonna dispose of that. So now that my sterile gloves are on, I'm gonna go ahead and rearrange my supplies. Okay, I'm gonna go ahead and open up my iodine swabs, place it into the tray. I'm also going to attach the water syringe to the balloon port. Okay, and then I'm gonna unsheath the catheter. And put it into the lube syringe. Okay, and I'm also gonna take out the urine specimen cup, open it up, and just leave it for here for now. Okay, and I'm gonna go ahead and place the tray in between the patient's legs. All right, Miss Jones, I'm gonna go ahead and disinfect your genitals once more. So I'm gonna contaminate my left hand, spread open the labia. I'm disinfecting it with these iodine swabs. Middle. Right. Left. And dispose of that. All right, now we're ready for insertion. All right, Miss Jones, I'm gonna go ahead and insert the catheter. It may be a bit uncomfortable, but just bear with me. Please take a deep breath in, and on my count of 3, take a deep breath out, okay? Okay, ready? 1, 2, 3, blow it out for me. Okay, perfect. Okay, so I do see some urine, which means I'm going to go ahead and advance the catheter about 1 to 2 more inches. Okay, now I'm gonna go ahead and reach over and inflate the balloon to secure the catheter in its place. Okay. All right. So now I'm going to go ahead and gently tug on it to check for resistance. And I do feel some resistance, which means that I have successfully inflated the balloon and that the catheter is secure in its place. Okay. So now I'm going to go ahead and collect a urine specimen. And since this patient was just catheterized, I do not need to kink the tube to collect the urine specimen since there's already a steady flow of urine. Okay, so now I'm going to go ahead and take my CHG wipe and scrub the hub for 5 seconds. 1, 2, 3, 4, 5. And I'm going to take my syringe and withdraw 10 milliliters of urine for collection. Okay. I'm going to go ahead and inject the collection into the specimen. And I'm going to dispose of the syringe in its appropriate receptacle. I'm going to go ahead and close up the sample. And I'm going to go ahead and label the patient's name, their medical record number, as well as the date and time of the collection. Okay, now I'm going to go ahead and put it to the side to send to the lab. Okay, now I'm going to go ahead and stabilize the catheter to the patient's thigh. So first I'm going to apply some skin protectant. Okay. And lock it in. And secure it onto the thigh. Like so. Alright, now I'm going to go ahead and lower the urine bag. How was that, Miss Jones? Did you have any pain? No pain? You were able to tolerate it well? Okay, perfect. I'm going to go ahead and hang the urine bag on the stable side of the bed, making sure that it is hooked on properly. Okay, now I'm going to go ahead and dispose of this. Okay, now I'm going to remove my sterile gloves, hand hygiene, hand hygiene 20 seconds, and I'm going to don some new clean gloves. All right, Miss Jones. So my work here is done. Let me go ahead and reposition you back for comfort. Okay. Now I'm going to go ahead and you can put your legs back to normal now. Here, let me assist you. Okay, I'm going to put down your gown. And here you go. All right, Miss Jones. So my work here is done. Do you need anything else for me before I go? No? Okay. All right, Miss Jones, so now I'm going to go ahead and raise the head of your bed. I'm also going to make sure that your side rails are up for safety, and your bed is low as well. And I'm also going to make sure that your collar is within reach. Please press the button if you need anything from me, okay? All right, Miss Jones, I'll see you later. Okay, hand hygiene. All right, so now I'm going to go document the date and time of the procedure. So I have inserted a urinary catheter on October 31st at 10 a.m. The patient tolerated the procedure well. They had no pain. The catheter that I used was a size 16 French, and the urine output that I observed was 500 milliliters, and it was clear and yellow, and there was no foul odor or any sediment. Making sure the door is closed, pulling the curtains for patient privacy, hand hygiene 20 seconds. Hello, my name is Susan, and I'm going to be your nurse again for today. So I just got an order from your provider to remove your urinary catheter, but before we get started with anything, I would like to verify that you're the right patient. Can you please state your name and date of birth for me? Jane Jones, date of birth January 12, 1960. Okay, everything matches. Miss Jones, do you happen to have any allergies? No allergies? Okay. And are you in any pain right now? No pain? Okay, great. And I do see that you are alert, responsive, and not in any distress. So I'm going to explain what I'm going to be doing today. So I'm going to be removing your stat lock sticker that is currently attaching the catheter to your thigh. And then I'm going to be deflating the balloon that is currently holding your catheter in place. And then I'm just going to be simply removing the catheter. Does that sound good? Okay, and have you had this procedure done before? Yes? Okay, right before I begin, do you have any last questions or concerns for me? No? All right. So I'm going to make sure that I have all my supplies, which is already on my workspace. So I have a chucks, an alcohol prep pad, 10 milliliter syringe, as well as some clean gloves. So now I'm going to go ahead and do some hand hygiene, and then I'm going to don some clean gloves. All right, Ms. Jones, so I see that you're already in a supine position, which is great. I'm gonna go ahead and uncover your blanket, like so. I'm also going to uncover your gown and expose you just a bit, like so, okay? And I'm gonna go ahead and open up your legs and assist you into a froggy position. Okay, now I'm going to place down the chucks in between your legs. This is just to catch any possible urine droplets, like so. All right, so now I'm gonna go ahead and just remove your stat lock sticker. I'm gonna take my alcohol prep pad, I'm gonna unlock it, place the catheter onto the chucks, and with the alcohol prep pad, I'm just gonna remove the sticker like so and dispose of it. I'm gonna do hand hygiene, don some new gloves, and prepare to deflate the balloon. So with the syringe, I'm going to attempt to extract 10 milliliters of water, or all the water from the balloon, just to deflate it, making it easier for removal. Okay. Like so. Now I'm going to go ahead and check for resistance. Okay, so I don't feel any resistance, which means that I have successfully deflated the balloon and extracted all of the water, which means that I'm ready to remove it. But in the case that there was resistance, I would have to go back with the syringe and attempt to extract some more water to further deflate the balloon. However, if that doesn't work as well, I'd have to just stop the procedure, leave the catheter in place, and call the provider. All right, but since I didn't feel any resistance, I'm just gonna go ahead and remove it. All right, Ms. Jones, this may be a bit uncomfortable, but it shouldn't be painful. Please take a deep breath in for me. And on my count of 3, please blow it out for me. Okay, ready? 1, 2, 3. Okay, perfect, Ms. Jones. How's that? Any pain? No pain? Okay, great. Okay, let me wrap this up. All right, now I'm gonna go ahead and you can go ahead and put your legs back to normal. I'm gonna help you unfroggy it. And I'm going to cover you back up, like so, as well as pull up your blanket. All right, Ms. Jones, I'll be back. I'm gonna go to the bathroom to empty out your catheter bag, okay? All right, so now that I'm in the bathroom, I'm gonna go ahead and pour out the urine from the catheter bag into a graduated cylinder and measure the amount. And while I'm doing that, I'm also going to take note of the color and any noticeable characteristics of the urine, such as if there's any strong odor or any sediment. Okay, so now that I've done that, I'm going to go ahead and dispose of everything in its correct receptacle. I'm going to dispose my gloves, hand hygiene. All right, Miss Jones, I'm going to go ahead and raise the head of your bed for comfort. Are you comfortable in this position? Yes? Okay, great. All right, Miss Jones, I'd like to give you a bit of education on what to expect and what to do. So for the next 1 to 2 times you need to urinate, please let me know so I can measure the output of it. This is just to make sure that you are urinating properly. You may feel a bit of a burning or a stinging sensation when you first start voiding again, but that's okay. That's completely normal. It should eventually go away once you within the next few voids. And lastly, please let me know if you're experiencing any severe pain when you're urinating or if you notice any blood in your urine. That way I can contact your provider and let them know. All right, does that sound good? Okay, do you have any questions about that or any concerns? No? Okay, great. All right, Ms. Jones, I'm gonna go ahead and make sure your bed is in the lowest setting. Side rails are up for safety. Here's your call light, putting it within reach. Please press the button if you need to go to the bathroom, or if you need anything from me, I will be right there to assist you. All right, Ms. Jones, so my work here is done. Thank you. I'm gonna go ahead and go document, but right before I do you have any last questions or do you need anything from me? No? Okay, great. All right, Ms. Jones, I'll see you later. All right, so now I'm gonna go ahead and go document the date and time of the procedure. It is November 3rd, 2022 at 1800. I'm gonna document that the patient has tolerated the procedure well. They had no pain. I'm gonna document the urine output, which was about 700 milliliters. I'm also going to document that the urine was clear and yellow. There was no foul odor, and there was also no sediments as well. And I'm also going to make sure to document the next 1 to 2 voids that the patient makes, documenting the urine output, the measured urine output, as well as the color and any noticeable characteristics of that as well.